Hi, everyone, and welcome to another week of content in MHA626, where our topic is consent, and that just advanced it pretty well for me. So let's talk about consent. Um, uh, in addition to this lecture, there's some very good stuff on the Blackboard site, some readings. I'm going to focus on one of the readings right in here as well. So why don't we get started? Okay. At the end of the module, hopefully you'll be able to identify issues of patient consent uh, from a few perspectives, primarily from the user and provider perspective, but also encompassing the organization. I'm using the term patient because we're talking about the consent process. I'm making it a little bit bigger, but we'll go into details as well. This could be in any area of healthcare as well. Now, I think the beauty of all this is all of you have been through this personally, and many of you have been through this with family members, perhaps friends, where you had to authorize consent, not only for yourself, but for loved ones. And so you understand this. This is one of the few areas that we understand professionally or personally, probably more so than we do professionally as well. So let's talk about the benefit of consent. Um, and it's really the consent process that I'm speaking about, as opposed to, as you'll see, a form, a document. And so I want to start with this notion of what a high quality consent process will look like. Let me actually pause and say that I have some, pretty in depth experience with this professionally. At one point in my life, I oversaw a registration and admissions department in a large hospital where we were tasked, and I was tasked as the director to oversee hospital admission, the process which involved consent. And really, at that point, I was more interested in streamlining the process and the consent form. But it taught me a lot about what perhaps a high quality consent process might look like. So I want to move away from the idea of a form, which all of us have signed many, many times, most of the time without really reflecting or reading in it because there's an element of trust. So certainly a high quality process assists patients in making informed decisions. It also strengthens a relationship. That could be a short-term relationship or a long-term relationship that a patient would have with a healthcare professional. It may improve future follow-up care, but it certainly engages individuals and a lot of times families, if families are involved or an adult or guardian is involved for a child. Because these last three bullet points enhances patient safety, averts delays or cancel services, and minimize legal connections can all be wrapped up into one bundle. But certainly the focus is on enhancing patient safety. Users understand or have a maybe not a complete understanding, but a better understanding, a more nuanced understanding of procedures, of outcomes, of risks and benefit. And certainly they're able to make a choice, an informed choice. And so because patient safety has catapulted to the front of our healthcare system, as it should, over the last 20 years, um, the consent process really is a key part to that. In fact, it is the start of that. It's the starting line, as I like to say. So I'm going to show you a chart here, and I hope you can read this. It's fairly small font. You're able to find it, though, on the AHRQ's website. I took it right out of a document from the AHRQ, Making Informed Consent and Informed Choice. And it really distinguishes roles and responsibility. Now, this is sort of a hospital example, so it may or may not apply to everybody, but what the rules and responsibilities are in this consent process. But what I like to highlight is it's a team process. It is not the responsibility, let's say, of one area, one person, one department. It really is a team process. And so whether it be a clinician or non-clinicians, or perhaps, as you can tell, interpreters as well, there are certainly lots of different roles. And you can tell this series of roles is more than you would expect than, let's say, a receptionist or a front desk saying, would you sign this piece of paper so we can file it and we can minimize our risk. There's a variety of different things in here. That's why it's a process, and I'll be talking about a few of them. But probably the most important thing that to recognize from this and where it comes down to from a legal and ethical perspective is it's not about the form. A signed form does not equal consent. Now, we can say, well, an individual, signed it and they dated it, and that's all we need. Sure, that you have a signature on the form. I think we understand that. And it might say, well, there's language on the form that they've understood the information, they've agreed to a particular treatment, and most of the time we understand what it is. I use the example of, just because vaccines happen to be on my mind, a flu shot where you have to sign if you get it at a pharmacy, or sign for a kid, something like that. And you have an idea of what's expected as well. But, and probably on the informed consent form, specifically to that vaccine, flu vaccine, are the risks. Perhaps a summary of the research that was done, the most relevant research. Most of us sign forms even when we don't understand the service. Now, partly because in states of vulnerability, we want the procedure, we want the diagnostic test, we want the medication, we want the X-ray, whatever it is, we need it. And yet, I think there's an understanding that, or let's say, there's still a lack of understanding. I'll say patient understanding, especially for those procedures that, I'm not going to use the term experimental, but may or may not, we're not exactly sure what the outcome is. It's going to be done on an outpatient or inpatient basis. And so there is always then a safety risk. And a lack of patient understanding, which may contribute to a safety risk, certainly puts everybody in a sense of liability, right? And even if the form is signed. And so there has to be better ways that the informed consent process, that the consent process can be improved. When it comes down to it, what we're talking about is decision-making capacity and, the ability of individuals to make decisions. No, certainly the foundation of that is the notion of capacity. You can see it means the ability and the right to make a decision. Certainly can change over time, and that's a spelling word here. I'm going to just spelling mistake, can vary depending on the decision to be made. Now, it can change over time. The individual can change their mind over time, or events can fluctuate, or their condition can fluctuate as well. But every person should be assessed for this ability to make decisions. And that, as I said, could change over the course of a day or another period of time. And if individuals are not able to make decisions, then certainly there can be disclosure at a different time. An authorized representative can substitute in the notion of substitute judgment or decision making, only when there's a lack of capacity or they've transferred that responsibility over to another individual. So for the most part, we are talking about adults here. But this idea is a fluid and ongoing concept. So how can the process then really change? And I want to refer you to the American Journal of Bioethics article. It's really a commentary, just a few page commentary. And let's see, I'm looking on page 34 on the second, on the right-hand side of the page, where the author, or at least the author, is spelling out with one of the references, Grimm situates that this is really about just the informed consent process, or the consent process shouldn't be just about knowledge and then signing away the fact that I understand the knowledge. It should be about knowledge and then really a deep level of understanding. So the patient is an active participant. Now, again, that could be the individual, that could be their representative, let's say an adult child, if it's an older adult. And then that needs to be translated in a very understandable and cohesive way, away from the form process, away from what they call rigid templates. And so there's some excellent, excellent work going on to really improve the informed consent process through interactivity. And the idea of interactive tablets, or where individuals can walk through processes, where there's sounds and videos and they can see a short something demonstration. Now, could that be done ahead of time? Yes. It might not always be possible to be done on, let's say, the date of a procedure, but there certainly is ability to do stuff in advance, to do it with mobile technology. Not just signing a form, but really walking through a process, especially if it involves some sort of, test or procedure. Now, a lot of organizations are doing this well ahead of time. I think about perhaps an outpatient surgery, which are, for the most part, scheduled procedures. Well, they are scheduled procedures. And they're pretty involved, but it involves, it can be involved watching a video in advance, understanding, so you have a general understanding, and that's all parties involved. And so certainly there has to be forms to sign as well. Yes, the consent process acknowledges that I do or do not want something, but there's lots of educational ways to engage participants in advance. Now, I'll tell you that the pediatric world has been doing this exceptionally well for years, mainly because their user is under the age of 18. Parents or guardians sign the forms, but it's understood, not young kids, but at a certain level, you've got to explain to kids what happens. That has not translated as well to the adult care world. And so I think that the American Journal of Bioethics article really points out how the use of technology really should be leveraged to improve the process. And with that comes an improvement in terms of patient safety, most importantly, user participation and understanding. Now, the reason that I wanted to spend a little bit more time going through this with you is it flows well into the content. Let's see well, first of all, it flows well into issues at the end of life content, but it also translates well into discussions in fraud and abuse, privacy, confidentiality and security, professionalism, and legal issues, essentially all of the content pieces in the course. Okay, so I'm going to stop right here, and please let me know if you have any questions. along the way about this, be sure to check out the articles associated with this content. All right, thanks.